All right, let's talk about something that can be pretty scary, finding a lump in your neck, and specifically thyroid swelling. It's a common worry, but the good news is there's a really clear, established process for figuring it all out. Knowing the steps can make a world of difference, so let's walk through it together.
Okay, so you found something. That moment, your mind is probably racing with a million questions, right? It can be full of anxiety. But the most important question is, what actually happens next? Well, there's a journey, and it starts with a systematic evaluation by your doctor.
So, first things first, we're going to cover the initial discovery and that all-important first checkup. This is really where the first clues start to come together. The very first thing that's going to happen is a physical exam. Your doctor is going to carefully feel the lump. They're checking out its size, its shape, and what it feels like. Is it soft and squishy or is it firm? They'll also do this neat little test where they ask you to swallow. If the lump moves up and down, that's a huge clue that it's actually part of your thyroid gland. Now, there are a few things doctors look for that they sometimes call red flag features. And listen, this list is not meant to cause alarm. Think of it more like a clinical checklist that just helps them prioritize what to do next. They're looking for things like, has it grown really fast? Does it feel rock hard? Is it kind of stuck in place instead of moving around freely? Other signs, like hoarseness in your voice or swollen lymph nodes nearby, are also important. These are just signals that tell the doctor, hey, let's investigate this a bit more closely.
After that initial exam, we move on to the diagnostic journey. This is where we bring in the technology, the targeted tests that give us a much clearer picture of what's going on.
And this journey follows a really logical three-step path. It almost always starts with simple blood tests to check on your thyroid hormone levels. Next up is an ultrasound scan of your neck, which gives an incredibly detailed look at the nodule. And then, only if it's necessary based on that scan, comes a fine needle biopsy to get a sample of the cells. This is the gold standard approach used all over the world. Okay, so let's zoom in on that ultrasound for a minute because it is absolutely the single most important imaging test in this whole process. What exactly is the radiologist looking for on that screen? Believe me, it's about way more than just the size of the lump. It's all about its specific features. One of the first things they're on the lookout for are something called microcalcifications. These are just what they sound like, teeny tiny little specks of calcium inside the nodule. Think of them like specific clues on a map. They can suggest one type of tissue over another. Next, they look at the border, the edges of the nodule. A nice, smooth, well-defined border is often a very reassuring sign. But if the margin is irregular, spiky, or kind of blurry, well, that's another one of those clues that tells doctors this particular nodule needs a closer look. And this is a huge question. Is the nodule solid tissue, or is it basically a tiny fluid-filled sac, which is called a cyst? A whole lot of thyroid nodules are just simple cysts, and the great news is that those are almost always benign. The ultrasound is fantastic at telling the difference between what's solid and what's fluid. So if those ultrasound features look a bit suspicious, the next step is often a fine needle aspiration, or FNA. I know, the name can sound a little intimidating, but it's actually a minimally invasive procedure. Using the ultrasound to guide them with pinpoint accuracy, the doctor uses a very thin needle to draw out a tiny sample of cells. Those cells then go to a lab to be examined under a microscope, which is how you get the definitive answer. All right, section 3, understanding the results. The tests are done. This is where all the data, all the puzzle pieces come together to give you a clear diagnosis and, most importantly, a clear path forward. Biopsy results are typically categorized using something called the Bethesda system. A benign result is great news. It means no cancer cells were found, and the plan is just to monitor it. Malignant means cancer is likely, and that leads to a chat with a surgeon. And here's the crucial part. Even for that gray area in the middle, indeterminate, there is still a well-defined plan. It's not a dead end. It might mean more testing or a diagnostic surgery, but you are never left hanging. And here it is. If you take away just one thing today, please let it be this. The overwhelming majority of thyroid nodules, we're talking over 90%, are benign. They are not cancer. It is so easy for our minds to jump straight to the worst-case scenario, but the reality is that non-cancerous causes, like simple cysts or some inflammation, are just vastly more common. And that brings us to our final section, your treatment path. So, once the diagnosis is clear, what's the game plan? Let's take a look at the options on the table. It is so important to know that surgery is not the only outcome, not by a long shot. Treatment is completely tailored to your specific diagnosis. For many, many benign nodules, the best course of action is simply observation with an ultrasound every so often. For others, it might be medication. Surgical removal is really reserved for nodules that are malignant, suspicious, or getting so big that they're causing problems with swallowing or breathing. Now, let's say surgery does end up being the recommended path. It's approached with an incredible focus on two things: safety and precision. The goal isn't just to remove the nodule, but to meticulously preserve all the critical structures around it. So here are the core goals of that surgery. First, surgeons make a careful incision, usually right in a natural skin crease so it's hard to see later on. Then comes the most critical part. They have to painstakingly identify and protect the nerves that control your voice. They also have to find and preserve these 4 tiny little parathyroid glands that regulate your body's calcium. And finally, the whole point is to remove only the amount of thyroid tissue that is absolutely necessary. So, after walking through this entire journey, from that first moment of discovering a lump all the way through the diagnosis and the treatment options, what is the single most important message you should take away from all this? It's this: a clear process exists. While finding a lump is absolutely scary, there is a logical, well-established path to figuring out exactly what's going on. It's a journey with a map. And understanding that process, knowing what to expect, helps turn that raw fear of the unknown into informed, decisive action.